Hi, friends. If you don't want to get cancer, then you should really consider fighting with folate to make up for last time. But it's not as simple as just taking a supplement or eating folic acid in rich foods like pasta, bread, rice, and sugary cereals. The source of your folate is just as important because I'm sure you know that our food is filled with artificial chemicals, dioxins, and forever plastics, and natural toxins like arsenic and cadmium. Your grandparents lived till 90 because they didn't get our special fillers, filling our bellies with processed foods or collecting in organ meats. Now, in addition to toxins, our nation is overfed and undernourished because our foods lack essential micronutrients like folate, and you can do what everyone else is doing and stick your head in the sand, like the ostrich or fight for your life and focus on food grade folate, which is very different from eating synthetic folic acid out of your spaghetti breakfast, cereals, rice, or supplements. Now, on top of that, if you have a methylated gene mutation, then you may not metabolize synthetic folic acid, which leads to a buildup in your system. And yes, that's a problem too. And we will get to that a little later. Now, here's a list of 12 natural foods rich in folate, which is bioavailable, unlike folic acid. Now, how many servings of folate-rich foods are you eating in a day? I buy these lentils in these giant bags because I'm trying to get as much as I can. Chances are you aren't eating enough for your metabolic needs. Rosity is an essential B vitamin B9, and we will talk about how that supports your DNA synthesis, cell division, amino acid, metabolism, and methylation. Now, these are all fancy biochemical terms that sum up how your body works, and understanding why is absolutely essential to choosing the best foods and avoiding the worst foods. Otherwise, you will once again be scrolling on the internet, swaying in the wrong direction, watching that next influencer short. And here's an example of the power of eating an adequate amount of folate for your body's needs. A randomized controlled trial in Bang the Dish found that 400 micrograms folic acid daily for 12 weeks reduced blood arsenic levels by 13.6% in those who had arsenic poisoning. Now, I know literally I said avoid the folic acid supplements and get food grade folate. But if you are dealing with the tremendous amount of stress like arsenic poisoning, then there is no way to achieve the doses that you need from food alone. So there is a place for synthetic vitamins when used appropriately, guided by a physician. This isn't medical advice. See your own personal physician to get personalized health care. However, not everyone responds to folic acid, and there are now much more viable forms of folate. But you may wonder, how did people even get arsenic poisoning? Well, in the 1970s, UNICEF installed 2 wells to bring clean water to millions of people in Bangladesh. The problem was they never tested their water for arsenic. So the water looked clean, and that's because arsenic is invisible. Too many people falsely believe that arsenic only affects third world countries. Well, have you checked where your food is grown? All food actually needs water to grow, right? So every country who fails to regulate pollution will have a none of arsenic as well as over 1,000 other pollutants. Our oceans are filled with arsenic, and that's because the world has turned our oceans into a giant toilet bowl. But there's plenty of arsenic tainted soil in the U.S., with the worst offenders being the Midwest, as evident by our homegrown rice arsenic content. So the president wants us to buy American, then the president needs to convince American companies to stop growing food and polluted soil and water. That chance that's going to happen without laws, with penalties. Now, obviously, it's important to avoid foods with arsenic as well as other contaminants. Um, but arsenic is kind of ubiquitous. It's not just in rice, it's in baby food, it's in seafood, it's even in juice. And did you know that the highest level of arsenic has actually been found in meat, fish, poultry? So I know that arsenic is in water, so I can understand why fish would have arsenic. But why does it gather in meat and poultry? And why was it especially concentrated in chicken? Well, that's because arsenic was a feed additive. Arsenic-based drugs were deliberately used to feed chickens and turkeys for, let's say, I think 72 years. It was used as a growth promoter. It helped reduce parasites and to improve the color of meat. This practice was widely banned by the FDA in 2016. So I grew up eating arsenic-tainted meats. So those animals had over 72 years to poop out that arsenic in the soil. Many countries still use arsenic in their feed, except in Western Europe. Hence, there's no one that doesn't need more than the RDA's recommended amount of folate. Without folate, you literally can't make normal cells because you can't make normal nucleotides or the building blocks of DNA and RNA. Without adequate folate. Folate is involved in the conversion of rural delete to find a delete, which is necessary for proper DNA replication. And without enough folate, cells struggle to divide, especially your immune cells. DNA makes genes, and RNA translates those genes. Intake of folate-rich foods is associated with lower risk of a softened yield cancer. That's a high trauma area, trying to mitigate all that gastric acid. Now, the problem with synthetic folic acid, despite some studies showing short-term benefit, is that folate acid has also been associated with an increased risk of cancer. Now, food folate, not synthetic folate acid, is always preferred on a daily basis. So don't get comfortable just because there's 4 to 5 vitamins in your breakfast cereal or high protein bar. Now, folate is critical for methylation because it is a key player in the 1-carbon metabolism cycle, which supplies methyl groups for biochemical reaction. Now, methylation is a fundamental biochemical process that occurs in billions of reactions per second across your entire body. And while it is impossible to count every single individual reaction, studies estimate that there are over 200 different enzymatic reactions that rely on methylation, and many of which aren't directly dependent on folate. And I mentioned that your DNA and RNA requires methylation. Those are responsible for your gene regulation and epigenetics. Number 2, you need to detoxify as well as your liver needs a function. Number 3, you need homocysteine to become methionine, and that supports your cardiovascular system as well as your ability to detox. Number 4, you need neurotransmitters in your brain as well as mood regulation. Number 5, you need melanin, which supports your nervous system and brain. And number 6, you need to break down histamine, which is an allergy, and immune regulation. Number 7, you need energy production for your mitochondrial function and metabolism. And number 8, you need to support your hormone and estrogen metabolism. The DNA methylation helps regulate gene expression by adding methyl groups, cytosine bases, and the process is essential for cell differentiation and development for silencing harmful genes like tumor suppressor genes or viral DNA for aging at epigenetic memory to prevent cancer and autoimmune diseases. And defects in fully dependent methylation leads to cancer, age-related disorders, and immune dysregulation. And folate isn't just critical for people. Many bacteria rely on folate for growth and replication. And unlike humans, Bacteria actually make their own folate de novo rather than obtain it from their food. Examples include E. coli, Staphylococcus aureus, Streptococcus pneumonia, Listeria, monocytogenes, and Mycobacterium tuberculosis. Now, these are just names to your ears, but these are the germs that fill my everyday bread and butter job as an infectious disease physician. Take tuberculosis 10. 8 million people around the world suffer from tuberculosis, and there's literally an outbreak right now of tuberculosis in Kansas City. Tuberculosis alone is a leading causal mortality from a single infectious disease. And all these people, they need to take tuberculosis drug, which are major causes of drug-induced liver injury during treatment. And this is a big deal because if you don't tolerate your tuberculosis drugs, drug business builds up and potentially your tuberculosis can disseminate all over your body and can take your life. But before you go, you're considered a highly infectious contaminated vector. And guess which people tolerate their TB drugs better? Those who increase their fruit and touchable intake, they tolerate tuberculosis treatment much better. And maybe it's also because people who take tuberculosis drugs often have a folate deficiency. Many of our prescription drugs actually cause people to lose folate. In fact, several antibiotics work by blocking folate synthesis in bacteria. That's how we kill bacteria. And these include silver drugs called sulfonamides and trimethoprim. And these drugs work differently. By combining the two of them, you actually get a combination synergistic mechanism of action, blocking folate metabolism in bacteria to cause them to die. And you may have heard of sulfamethoxazole and trimethoprim combo or bacterium. Sulfamethoxazole is a competitive inhibitor of dihydropyritate synthase, and enzyme bacteria need to make folate. And this prevents the DNA synthesis leading to their bacterial demise. Now, trimethoprim, it blocks dihydrofolate reductase, preventing the conversion of dihydrofolate to tetrahydrofolate, which is essential for DNA and amino acid synthesis in bacteria. But we also use tetrahydrofolate. There is a cross reaction. So long-term use can potentially cause folate reduction in people. And there are several other drugs that can cause folate deficiency. And this includes methotrexate. We use methotrexate for cancer chemotherapy for autoimmune conditions such as rheumatoid arthritis and psoriasis. This drug inhibits human dihydrofolate reductase, so it prevents the breakdown of our own cells from metabolizing folate, and therefore it compromises DNA synthesis. And this affects rapidly replicating cells like cancer cells and immune cells. In turn, this makes people anemic, neutropenic, and thrombocytopenic. So basically, it suppresses cells that rapidly turn over in the bone marrow. Your amicosal memory, including your gastroesophageal tract, also rapidly turns over. So this can lead to nausea and diarrhea and potential malabsorption problems. Now, the liver rapidly turns over too because it gets hit by toxins. And so if you don't help it replenish its cells, well, it will be very unhappy. And that's when the liver enzymes elevate. It needs folate to repair itself. Now, other agents that inhibit folate include 5-fluorouracil or 5-U and capecitabine. These are used for colorectal breast cancer, and these agents interfere with them in delayed synthase. And in time, that requires folate to make DNA bases. People who take seizure drugs like phenytoin can deplete folate levels by affecting gut absorption and metabolism. It's important to methylate. Methylation aids in detoxifying heavy metals. Chemicals and estrogen, it's involved in the metabolism of drugs and alcohol. It is involved in glutathione production, which is a master antioxidant. This relies on folate and other methyl donors where methylation leads to toxin buildup, chronic fatigue, and hormonal imbalances. Catechol methyltransferase. That uses methylation to break down estrogen and stress hormones like dopamine and epinephrine. So poor methylation can lead to a buildup of estrogen and increases the risk of breast cancer and fibers, as well as other hormonal imbalances. It's a lack of folate increases your risk of hormonal cancers, PMS, and adrenal dysfunction. Millions of people turn to caffeine for fatigue, or they go on a highly restrictive fat or standard American diet of processed foods. Well, if you don't have folate in your diet, methylation regulates metabolism and ATP production, which makes energy, and it does so by regulating carnitine synthesis and creatinine production for your muscle and your brain function that won't turn out so well. So poor methylation can contribute to chronic fatigue, muscle weakness, and metabolic disorders. College is suffered horribly from hay fever. I used to attend chemistry lab performing all my experiments, and it wasn't because I was talented. It was because my other hand was busy holding up a tissue to my nose because I was training like a faucet because of hay fever. Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be, and I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in our show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video. Now, at that time, I lived in the dorm and ate dorm food for 3 years. I was severely folate deficient. All right. I was not eating folate rich foods, nor did I take a supplement with a multivitamin. I had horribly high histamine levels for several years, not realizing that I could have helped myself just by changing my diet and targeting folate rich foods. The histamine and methyltransferase enzyme uses an adenosylmethionine, the universal methyl donor, to break down histamine. High histamine and poor methylation basically causes chronic allergies, asthma, and inflammation. It's also linked to mast cell activation syndrome and autoimmune conditions. The lack of folate will just make you a grumpy and stress, interfering with your brain function and mood regulation, because there are several folate dependent methylation that is critical for producing dopamine to help you focus, to get you motivated, to help you have pleasure, serotonin to regulate your mood, your sleep, and your appetite, norepinephrine and epinephrine for your stress response and energy. And in addition, methylation is required for producing phosphatidylcholine and sphingomyelin, which are key components of myelin sheaths that protect your nerve cells. So folate deficiencies impair this process, leading to neurological issues such as brain fog and neuropathy. Hence, methylation defects can cause depression, anxiety, ADHD, schizophrenia, cognitive decline, multiple sclerosis, neurodegenerative diseases, and nerve damage. And by the way, did you know that sunlight makes deficiency even worse? So without folate, you will have first dry skin, or maybe healing issues and chronic ulcers, maybe even in your mouth and tongue. All right. And if you're severely deficient in folate, we can then test your blood to see evidence. You will have large red blood cells and overall less red blood cells. This condition is called megaloblastic anemia, which is a very serious blood disorder caused by defective DNA synthesis, leading to large immature red blood cells called megaloblastic. These don't function properly. And by the way, vitamin B12 deficiency can also cause an exact same problem, oversized red blood cells, which have an impaired hemoglobin function, leading to poor oxygenation transport, which then causes fatigue, weakness, dizziness, and shortness of breath. And without folate, you get other toxins build up like homocysteine, which can also test in your blood, elevate a homocysteine levels, damage blood vessels, and increase the risk of heart disease, stroke, and blood clots. This is sound good. Doesn't fully simply donate a methyl group to homocysteine, and that converts it to methionine. The methionine synthase, this requires actually vitamin B12. Methionine is used to produce acetinosyl methionine, the universal methyl donor in the body. So if you're worried about dementia, then you should pay attention to folate levels. As a lack of folate causes memory problems, mood changes, depression with or without dementia, and cancer. So it's not just your brain, your peripheral nerves get damaged too, resulting in tingling, numbness, and difficulty walking. Your largest peripheral nerve is your vagus nerve. So it shouldn't be unexpected that you have poor digestion, nausea, weight loss, and loss of appetite. The fastest growing cells are your mean cells, and that's why if you're folate deficient, your mean system will take a massive hit. It won't be able to scout out bad cells and take them out. You will be more susceptible to infections, slow healing, and cancer. And healing includes your muscles. And if you have sore muscles, could you be low on folate? Folate is essential for amino acid metabolism for several important amino acids such as methionine, cysteine, serine, glycine, and histidine. The synthesis of methionine from home-assisted is catalyzed by methionine synthase, an enzyme that requires not only fully as fine methyl tetrahedral folate and vitamin B12, but also vitamin B12. Hence, if you're missing either one, folate or vitamin B12, you will make less methionine and accumulate home-assisted, which increases your risk of chronic diseases, including cardiovascular disease and dementia. So when you have less blood flow from those cardiovascular diseases, you will also have impaired muscle healing. Folate, remember, helps produce SND, methionine, key methionine, and methylation controls gene expression, neurotransmitter production, detoxification, and hormone metabolism. Proper methylation supports your mental health, your liver health, your cardiovascular health, and your immune health so that you can help prevent cancer. Folate is essential for the levels. You want to convert it to methionine so that you can use that for protein synthesis and detoxification. We don't want to increase our clotting or risk for heart disease, neurodegeneration, and inflammation. That's what you get with high homocysteine levels. Besides having really bad anemia, folate is necessary for the rapid cell division of precursor cells in the bone marrow. So without folate, your bone marrow cells suffer. They stay immature, red blood cells. It's like a bunch of teenagers trying to regulate and man your FAA. Hence, this leads to anemia, especially because your hemoglobin is abnormal. Hemoglobin carries oxygen in your blood cells, and it relies on folate-driven DNA synthesis. Low folate can result in low hemoglobin levels, low blood cells, which result in low oxygen, causing fatigue, weakness, and shortness of breath. Does it sound good, doesn't it? Folic acid is more stable than folate in cooking and baking. And this is sure that you will still get some folic acid in your foods. But we fortify grains to reduce neural tube defects in fetuses, which is great. We've also encouraged women of childbearing age to take premenal vitamins, especially if they're planning to conceive. So one way thing that this is enough to supplement, and the rest we should get in whole food. But why are we adding synthetic folic acid to food? When there are plenty of foods like hundreds, if not thousands of foods with folate for both people who are pregnant and regular people to enjoy, you just need to eat enough of them. But the problem is, in majority of people who are eating in rich flours, breads, pastas, rice, and breakfast cereals, while they aren't pregnant. And they will never get pregnant, as half of the population is met. The U.S. government subsidizes a green industry, and maybe folic acid is just another reason to push grains and justify that. The food is supplemented, so it's a bit healthier. With our taxpayer money supplementing the processed food industry, does this trillion-dollar food business really need our taxpayer money? We not only have to put money in it so that they can make all these processed foods, then we ask taxpayer your money to actually help patients who eat those processed foods. We plug it into the medical system through Medicare and medical. In fact, we not only support the processed food industry, but by producing the food, we also help to clean up their mess. So we've solved the neural tube defect and treated it for diabetes, high blood pressure, mental health problems, obesity, and cancers. Does this sound ironic? We've already have hundreds and thousands of foods rich in food-grade folate. It seems like we're living in some backwards alternative DC universe. 90% of people, they don't need enough fresh folate-rich produce. And there are no subsidies on these produce, which are lower the barrier for people to eat this stuff. Now, if you look at the CDC website, it literally states that there are no health risks identified from a metabolized folic acid. If you read further down the bottom, it also states that folic acid has been shown to increase the risk of developing colorectal adenomas or colon cancer. To me, that sounds like a health risk. I wonder why we're having an astronomical rate of colon cancer. It's also been associated with an increased risk of prostate cancer. Doesn't that make you wonder why our colon cancer rates are going up? And why we were taught that prostate cancer is universal. If you live in America, so we're spending billions of dollars on chemotherapy and millions of dollars for the food industry to fill our tummies with toxic chemicals in our processed foods. I'm not just talking about folic acid. I'm talking about the plethora of food coloring, artificial flavor, sugar substitutes, sugar itself, high fructose corn syrup, the oils and fats. And that's not including the toxic heavy metals with cadmium and arsenic and lead. And I think I forgot the fluoride plastics that are now found in human brain. Ironically, there are chemicals that aren't even 1 million people worldwide. They proudly consume this stuff. It's called alcohol. It's a $260 billion industry. And I find this strange that the economic burden of alcohol in the U.S. is $20.49 billion, in which taxpayers support Medicare, of which $3 billion pays for all the complication of alcohol. So instead of banning alcohol, the FDA spends his time banning supplements. And I think there's bigger fish to fry, don't you think? Clearly, we are not focusing on the right problems that take the lives of 178,000 people. Now, to mention the families and friends that people who drink affect, this is truly a dark, like DC comic multiverse. I'll call it damages anything that it touches from your mouth, the esophagus to your stomach. And when it gets in your testing, It can damage your intestinal lining. We do see the absorption of folate from your food. Even if you eat folate fresh food, this increases intestinal permeability, which allows folate to just pass right through your gut into your poop without being absorbed. And in addition, alcohol increases folate loss through your urine and your bile, leading to rapid depletion. In addition, alcohol interferes with folate transport protein, making it harder for cells to absorb folate. It reduces folate storage in the liver, the main site of folate metabolism. Alcohol blocks key folate-dependent enzymes of Indian synthesis and repair. This all increases your risk of cell mutations in cancer, especially in your liver, in your colon, and breast tissue. As little as 1 drink a day can increase your risk of breast cancer, and it doesn't matter. That's beer or hardcore liquor. There is more than 100 studies to look at the association between alcohol and breast cancer. And indeed, breast cancer rates increase when you drink alcohol. So if you're doing that in your youth, don't be surprised to get breast cancer. A couple of decades later, alcohol increases estrogen and other hormones that make cancer grow. It can increase folic acid, which can lead to an increased risk of cancer. And this is why you have to understand that synthetic folic acid is not the same as food-grade folate. Remember, alcohol damages the liver, which is responsible for converting synthetic folic acid into active methylfolate. You find synthetic folic acid in your bars, your breakfast cereals, your grains, and potentially your multivitamin. So when you slow down folic acid conversion, this elevates metabolized folic acid in your bloodstream. And you slow it down because alcohol inhibits the hydrofolate reductase, the enzyme that you need to make your folic acid active folate. Unfortunately, a metabolized folic acid is not secreted as efficiently, so it lingers in your folate, synthetic folic acid. It requires enzymatic conversion, which we just talked about, and buildup leads to immune system suppression because it impairs natural killer cell activity. It can potentially elevate your risk of cancer, promoting cancer cell growth. It also masks B12 deficiency, leading to potentially irreversible nerve damage and other neurological issues such as brain fog, anxiety, and cognitive decline. And by the way, there's a large portion of our population of people with methylation gene defects, which make them unable to use folic acid because their enzyme is just not very efficient. So these people, if they eat folic acid enriched foods, they're going to have higher folic acid blood levels, which must be activated by the hydrofolate. And people may have a deficiency in this enzyme. The hydrofolate is converted by second enzyme into 5-10-methyl tetrahydral folate. And this second enzyme is called methylene tetrahydral folate synthase. And some people may be missing this enzyme too. So another enzyme, the methyl tetrahydral folate reductase enzyme, is needed to convert 510-methyl tetrahydral folate to 5-methyl tetrahydral folate. Now, these are all pretty big words, but the main point is you can't folic acid and expect it to work. The body needs several enzymes to get it from point A to the end bioactive compound called 5-methyl tetrahydral folate. Now, when you eat whole foods rich in folate, they not only have folate, but they have a ton of other antioxidants and fiber. And the beauty of this folate is it's already in the tetrahydrofolate form. So I can bypass the first enzyme, the hydrotetrahydrofolate. However, if you're missing the second enzyme, methyl tetrahydrofolate reductase, then you actually do need to take a methylated folate supplement. because ultimately you won't be able to make your methylated folate, so you can have to take it exogenously, because that methyl group is a universal methyl donor for all these other chemical reactions. And many of these systems actually support your DNA synthesis and your immune function. Obviously, getting enough folate is one way to reduce your risk of cancer through activation of your natural killer cells. And if you want to learn other ways on how to activate your natural killer cell system, watch the next video.